Around the world, drinking and driving has become a systemic problem of global public health importance. It's an issue that deserves time and attention, personal and legislative change, and creative problem solving. Did you know that around the world, drinking and driving contributes to more than 20% of alcohol-related deaths? As we dive into this topic, let's be clear. We're taking no stance on whether or not people should be drinking. We're presenting the equation of what happens when you combine alcohol and the choice to drive. But our message is not just for alcoholics or people who go out partying. This topic applies to everyone worldwide. Even if you just drink 2 beers, this still applies to you. So moving forward, what does your brain do while you're drinking? Alcohol can slow your reaction time, lead to a lack of coordination, reduced concentration, decreased vision, and inhibit your judgment. Add a moving vehicle to this, and this can be a deadly mix. Drinking and driving is not just a United States or Western country problem. Around the world, road deaths involving alcohol have reached staggering numbers. In 2005, and in South Africa, 58% of road accidents involved alcohol. In Canada, the United States, Australia, and France, about a third of road accidents involved alcohol. And these are just reported statistics. There's no way of knowing in other countries with less traffic accident reporting what the true statistics are. Did you know that 1 in 3 people around the world will be involved in a drunk driving crash in their lifetime? And in the United States, 1 in 3 traffic fatalities involve a drunk driver. In 2010, over 17 million people in North America admitted to driving drunk. If all 17 million of those people had their own state in the US, it would be the 5th largest. On average, a convicted drunk driver has driven drunk 80 times before his or her first arrest. In this scenario below, 1 beer equals 1 time driving drunk. So what leads people to these states? It's not just college kids or alcoholics that are at risk of drinking and driving. Yes, social norms, stress, trauma, and addiction can lead people to drink. However, people are also at risk when they say things like, oh, let's just grab a drink after work, or I'll just have 1 more, or oh, top her off, or hey, let's hit happy hour. So what does the world do to curb this problem? Banning drinking isn't the answer, but there are things that both individuals and governments can do. Local communities can fund better public transportation, including late-night transportation solutions and sidewalks. Other policy solutions could involve sobriety checkpoints or adjusting the drinking age or driving ages of an area. Personally, individuals can get in the habit of using rideshare resources or designating a driver before they go out. Each of these solutions on their own is not enough, but continuing to educate in schools, colleges, and at the community level, hopefully we can begin the process of change. In 2015, the WHO developed an action plan called the 2030 Agenda for Sustainable Development, hoping to provide funding and education to halve road fatalities by 2020. Hopefully some of these initiatives can combine to develop change and decrease the incidence of drinking and driving worldwide.